Welcome to From the Front Lines, Surgeons' Voices for the American College of Surgeons Bulletin Brief. With me today is Dr. Mariam Eskander, who is in her second year of Surgical Oncology Fellowship at Ohio State University. Welcome, Dr. Eskander.
Thank you. Pleasure to be here.
Thanks for taking the time to speak with us today, and thank you for all that you've done on behalf of the Resident and Associate Society as their representative on the program committee for our annual clinical congress. When you took on the job, I think a normal standard annual clinical congress was being planned and had been proposed and in fact approved. Suddenly things changed, and we've heard from some other interviews how much change that entailed. At the end of it, we're left with a very unique, exciting program. Could you first tell us some of the facets of the program that are going to make it even easier and better for residents and fellows than would be the case in person?
Yeah, absolutely. I think this is a remarkable opportunity for residents to attend. First, the program is free, which is wonderful. It usually doesn't cost very much, but a free program is even better. Secondly, it's entirely virtual and will be available for some time after the 5 days. The third thing is part of the program is over the weekend. And in fact, the part that's specifically geared toward young surgeons is the Saturday and Sunday component of Congress. And so we really thought about when most residents would be off and available and tried to gear kind of the timing of some sessions for them. I really hope that it'll mean more residents can attend either at the time or watch the sessions a few days later.
Could you please describe for us some of the specific sessions that might be of interest to residents and or fellows?
Yeah, absolutely. So speaking of the Saturday, Sunday content, so we fit the entire scientific forum into Saturday and Sunday. So as you know, the scientific forum is largely made up of presentations by young people, so medical students, residents, fellows who are presenting their work to the community. We wanted to make sure basically that folks would be available at the time of their presentation and there to watch the scientific forum. So in terms of scientific content, that's really geared toward young people on Saturday and Sunday. We have a medical student program, which we've always had, that's going to be virtual. We have a resident program that we are changing the timing of, to allow residents after sign out to attend the evening session. And some of the content of that is geared toward, finding a job, negotiation, contracts, things that aren't commonly taught during residency, but that we all want to know about. And then finally, there are a lot of panels geared toward young surgeons. There are panels on the job search. There are panels on non-clinical topics that I think residents will find interesting. And then again, there are clinical topics, the whole gamut of whatever general surgery or subspecialty topic.
Thank you. In addition to the academic sessions, one of the highlights of the American College of Surgeons for residents and fellows and medical students is the ability to interact in a social setting as well, in less structured formal settings. Will that type of opportunity exist, and if so, how?
Yeah, and that was one of the tough things, right, about a virtual Congress is how to preserve that interactive component. We are going to be manning the chat function for every session. And so there'll be the opportunity to interact virtually, ask questions for all of the panels and all of the scientific forum content. It's going to be different, right, because it won't be in person, but those of us who have been using the chat function for years, I think will be quite adept at it. But there'll be a moderator who's in charge of directing kind of questions to the right person and answering questions. And so we won't see each other face to face, but there will, I hope, be a lot of dialogue via the chat function.
Good. That's excellent, and it's very important. In addition, I've heard that there may be some alumni receptions and some other type of events geared for resident associates. Do you have any information on any of them?
Yeah, absolutely. That's one thing that we can't do without at Clinical Congress. It's the time when all the people from your medical school or the folks from your residency or your training program get together, and those will be virtual events that will happen at, I think, the evening times. So there'll be the opportunity, of course, to see all the people who you want to see in an in-person Congress.
Excellent. Thanks very much. That is an important aspect of the program. It's a great opportunity to connect with old friends and make new ones in the networking part of the college. Thank you very much, Dr. Eskander, for your time today and for your efforts on behalf of RAS and all of us fellows with the program committee. It sounds like we've got a sensational program, and I commend you for ensuring the content for residents and fellows and medical students is focused on Saturday and Sunday when they're most likely to be able to get to it. By the way, will they continue to have access to that material after the Congress ends?
Yes, absolutely, which I think is a huge perk. So if for some reason you're working that weekend, you can access the content after.
Thank you once again, and I look forward to meeting you in person someday at an upcoming future clinical congress. Wish you success in your fellowship in the meantime.
Thank you so much.